Good morning. Thank you for joining me this morning. My name is Rebecca. I'm from thenaturalbirth.org. And this morning we're going to talk about something I'm really passionate about. We're going to talk about the cascade of interventions that is so common in modern birth practices, to sort of give you an idea of how you might look at these interventions, to understand how these interventions are related, and to understand how they may implicate your desires for a natural birth. So my goals for this presentation are to teach you what the most common OB interventions are during birth, understand how the interventions are related to each other, learn how to avoid the interventions or maybe choose a lesser intervention so that potentially this cascade effect does not happen, and how to problem solve some difficult situations. There may be times when a specific intervention is absolutely indicated for the safety and well-being of mom and or baby, and to help you problem solve that into knowing that you may have control over not slipping down this slope. So without further ado, I want to share my story with you before we get into the nitty-gritty details of this. So I found myself pregnant and due on Mother's Day of 2013. And when I was pregnant, I did a ton of research. I wanted to know everything I could get my hands on about birth, how it worked, what I needed to do to make my dream birth happen. I wasn't even really sure I knew what my dream birth was. I just knew that the thing I saw on TV was not what I wanted. And I started to ask questions. I started to wonder, well, why does birth look like that? Why do we even have babies in the hospital? It seems like that is a really funky place to have a baby, considering how many people have inhabited the planet. A very small fraction of those people were actually born in hospitals. So why is there this change, and how can I best up my chances of having a fairly minimal intervention birth? So my strategy was to take a class. I took the Bradley method, which is a very common natural childbirth method class that's available around the world. I also did a lot of Googling and a lot of blog reading, and I picked the brains of professionals at work. I work at a hospital. I'm a physical therapist by trade, and I had access to a ton of resources just because I work in a hospital. And even with all my research and classes and talking to the experts, I still had gaps in the information, really wanting to understand this whole process and really wondering why it was such a mystery. That was a big question of mine. Like, why is birth so mysterious? Of course, 100 years ago, everybody saw babies being born. It was done at home, and you had probably seen your mom or your aunt or your sister or someone give birth before you actually did. And now it's sort of secret, which makes it that much more scary, in my opinion. So I did a lot of research, and I felt as prepared as I possibly could have been going into my birth. I went into labor after working a full day and doing errands. I went into labor about 10 o'clock at night. My contractions started about 1 every 10 minutes. It took me probably a good hour to figure out that I was actually having contractions. I was just generally uncomfortable from being full term and having been on my feet all day. I was achy and sore, but I started to notice that soreness had a pattern to it. And fairly quickly, my contractions got to 1 every 5 minutes, and then 1 every 2 to 3 minutes. And about 8 hours in, with really minimal sleeping, because I was having a hard time really sleeping through the contractions. So now it's like 5 or 6 in the morning. I decided to call my doula. My husband and I had decided that we wanted to have an additional support person at our birth, for both of us, both to keep us calm and to help guide us. And, when you're in the hospital, which is where I gave birth, you're really alone a lot of the time. And I wanted my husband especially to have the support of someone else. We don't have any family in the area where we live, and it was someone to sort of fill that gap. So I called her and she asked me a few questions about my contractions and about my symptoms. And she said, oh, well, I'll get my boys ready for school or get their clothes laid out and then I'll be over. I said, okay. And as soon as I hung up the phone, I knew that that was a wrong answer. I knew that I really wanted to go to the hospital because I was mostly concerned that I didn't want to sit in the car for 25 minutes. The way I was feeling, I couldn't imagine being strapped to a seat for 20 or 25 minutes that it was going to take us to get to the hospital. So that's ultimately what made my decision. I knew that my contractions were close together. I of course was hoping I was a lot further along than I actually was, but it was the car ride that really made me think that we needed to switch locations. So I called her back and said, no, how about you just meet us at the hospital? So we got to the hospital. They checked me. I was 4 centimeters dilated. I was 75 or 80% effaced. I was in fact in labor. They were seeing contractions on the monitor, which of course is every pregnant woman's dream to know that you're not crazy and that things really are happening. They asked me if my water broke and I sort of looked at them and felt kind of stupid for just looking at them and saying, well, I don't know. And they said, what do you mean you don't know? And I said, well, I've been leaking fluid for 24 hours or so, but it's not a lot. It's just a teeny tiny little bit and it doesn't smell and it's clear. And they said, oh, are you sure you're not wetting yourself? And I said, no, I'm positive it's not urine, but it's not a lot, but obviously it's coming from somewhere. So they did a little test just by using a little indicator strip and determined that I was leaking amniotic fluid and decided that for that reason that they would admit me. I think if that had been negative, they maybe would have given me the opportunity to go home. And I honestly can't say I probably would have taken them up on the offer just given how I was feeling. So I progressed really well. I, by noon, was 6 centimeters. I was walking the hallways and in the bathtub, and I really wanted a water birth, so they were filling up the birth tub. They made the therapy ball available and the squat bar available, and I did it all and progressed great. And the doctor and nurses, apparently, unbeknownst to me, were telling people, we're going to have a mid-afternoon baby. She's doing really well. We don't see any complications. Mom and baby are tolerating everything great. So I labored on, and mid-afternoon, I was still 6 centimeters. And by dinner time, I was still 6 centimeters. And by this point, I had worked the whole day before and then done errands and gone into labor at 10 and hadn't slept all night. So I'd been up and active for a very long time and really didn't eat much after dinner the night I went into labor. So I was starting to run low on energy, and the contractions did not seem to be letting up. They didn't seem to be getting closer together per se, but they were definitely frequent and occasionally stacked on top of each other. And I had myself convinced many times that I was in the transition phase of labor, which is right before the pushing stage, several times. And obviously I was wrong. So I can't say that I was necessarily disappointed because I had sort of mentally taken myself to a place where I really wasn't there. And this was just something I needed to do, and I wasn't making progress, and it meant I just need to keep doing what I'm doing, and eventually this is going to be over. But the doctor started to be concerned about my energy, and so she recommended that maybe they break my bag of water completely, because at this point I'm still just leaking a little bit of fluid here and there, but nothing major. And of course, I had my reasons why I didn't want to do that. I had done my research. I knew the pros and cons of breaking the bag of water to either start labor or augment labor. And I really didn't want to have any interventions. And I am really stubborn. And the doctor was wonderful and said, I just think it might help you progress and have the kind of birth you want to have. And then she left the room and let us decide. And we talked about it. And between my doula and my husband and I, we decided that there really wasn't much to lose by doing that I was far enough along. I was somewhere between 6 and 7 centimeters that I was going to deliver this baby within that sort of 24 to 48 hour window, which is what they like if your water is broken. So when the doctor came back, I asked her to do that, and almost immediately went into the transition phase of labor. And that was horrible. I was in the bed and I really didn't want to be in the bed, but that's where they put me to break my bag of water. And I was so uncomfortable, just writhing in pain, could not relax. The whole labor, I feel like I did a pretty good job staying disconnected from what was going on. I closed my eyes. I went to my happy place. I was very much not interactive with the people around me, but transition was a different phase. I had my eyes open and I was definitely loud and writhing around and couldn't get comfortable, and somehow managed to gesture and whine to the people around me that I really wanted to get in the tub, and could I please get in the tub? And so with the help of a couple people, I got off the bed and took a couple steps to the birth tub. And as soon as my belly was below water, I felt relief. It didn't make the pain go away completely, but it made it much more tolerable. It made it from, I was absolutely positive I was going to die, to, okay, this isn't pleasant, but I can do this. I can get to the end. If I can stay here, I can get to the end. So I labored in the tub for maybe another hour or two, and progressively got more to the point where I felt like I wanted to push. And at some point when I was I hadn't been given the okay to push, but I was sort of doing these little grunty pushes, my doula asked the nurse to check me. She said, I think she's close. I think this is going to happen sooner rather than later. And the nurse checked me. I was fully dilated. They let me stay in the tub to check me. The nurse said, if you want to push at any time, if you feel the urge, you go ahead and push. And that was like starting the race for me. I suddenly took on this whole new persona of I was disconnected and I was trying to sort of step away from the situation. And as soon as they said, you can push, I was there, I was present, and I decided this has got to be over now. I'm done being pregnant. I'm done being in labor, and I want to meet this baby so badly. So the next contraction, when I felt like I had the urge to push, which was almost immediately after them telling me I could push, I pushed for maybe 5 to 10 minutes, and my baby was born, and the doctor was only there for like the birth of the waist and the toes. And it was peaceful, and the lights were low, and there was just a handful of nurses and one doctor around. But for the most part, they just watched because I was in the tub. So I scooped my baby up off the bottom of the tub and put baby on my chest, and it was beautiful. It was wonderful. There's almost nothing I would change about the experience. I didn't know the gender of my baby before it was born, but I found out pretty soon, as soon as I remembered that I didn't know the gender, to turn the baby around, that I had a son, and he was 6 pounds, 6 ounces, 19 and a half inches long, perfectly healthy, alert and bright-eyed, and had no complications. I got out of the pool to deliver the placenta, and I had no tearing, and the placenta delivered not quite as quickly as I would have liked, but it came on its own without any intervention. So that's where I come from. I certainly have not closed the door on the idea of another child, but for now my experience is one, and there's nothing I would have changed about it. And I felt so empowered and so impressed by what the human body can do that I found myself getting on my soapbox when people would tell me that they were pregnant, just thinking like, educate yourself. You need to learn about what interventions there are and what they might do, because birth is a really magical, wonderful thing if you allow it to be. Unfortunately, most women in the US especially have some sort of medicated birth and often are traumatized by birth and have PTSD from their birth. And it doesn't have to be like that. But unfortunately, the big missing link for most people is education. The only things they know about birth are what they hear from their families and their friends. And of course, family and friends don't share the oh, my birth was wonderful and magical, they share the scary stuff because it's sort of what they perceive as the outlier. So that's what gets shared. And so birth is this huge medical event that's scary, and you have to do what the doctors say and all of that. And it doesn't have to be like that. And so my goal is to bring this information to people who are interested and or can't access the information in their local area if classes aren't available, to try to empower other women to at least be educated about the birth experience, regardless of what choice you make for you and your baby, what kind of birth you have, or what kind of interventions you're okay with. That's your own decision. But having the information is absolutely essential to making an educated decision. And parenting is really one educated decision after another, and lots of mess ups in between. So it sort of sets a good precedent for the parenting journey. So I want to encourage you to start brainstorming about what you want for your birth. Where is it going to be? Who's going to be there? Do you like your provider? Are there other providers in your area that might be a better fit? Those sorts of questions. So I've created a survey at anaturalbirth.org/survey. It's free. You just go on there and download it and fill it out and use it as talking points for you and your partner and whoever else is going to support you in your birth, to talk about these things, because there's really no reason for you to be disappointed in your birth because of your provider, simply because you felt like you didn't have a choice. Of course, insurance will limit things. Certain financial situations will limit things. But if you're able to have a choice and you don't feel comfortable, it's okay to switch providers even once you're pregnant. That's an okay thing to do. So this survey sort of talks about just how you're viewing your pregnancy, how you're viewing your ideal birth. Do you even know what your ideal birth might look like? Because that ideal birth sort of sets up what your birth plan might be. And that's a great communication tool for you and your provider. So I'd encourage you to do that. So the cascade of interventions, the topic for the day. What is the cascade of interventions? So there's lots of interventions that happen during birth, but I've sort of boiled it down to the big ones that tend to move the procedures into the next one. So there might be little things like an IV placed, or maybe even breaking your bag of water that doesn't necessarily implicate the next thing that happens. But these three things are very tightly related to each other. And very often, if one of them happens, the next one will happen. And the research supports that this is a slippery slope, that getting Pitocin ups your chances of taking an epidural. And if you have an epidural, your chances of C-section are higher. Or your chances of an assisted birth, meaning using a vacuum or forceps and or a episiotomy, is increased. So in today's talk, we're not going to talk about assisted birth. We're going to talk about specifically C-section. But know that epidural, even if you don't get a C-section, which would be fabulous, that delivery can be more challenging because of the epidural. And we'll talk about why. So the first one, Pitocin. Pitocin is a synthetic version of a hormone that your body already makes, oxytocin. So oxytocin is the hormone of affection, of love. It's released when you snuggle with someone else. It's released when your baby is breastfeeding. So it's a feel-good hormone, and it is instrumental in progressing your labor. And because of that, when labor doesn't start, or labor starts and then stops, Pitocin is often the first place that medical providers go to get things started again. So what it does is it causes your uterus to contract. And how it's used is twofold. So scenario A is your 42 weeks. Your doctor doesn't want you to carry any longer because you're 2 weeks past your due date, and your cervix has started to make some changes. Maybe you're a centimeter or two dilated, but you're not having any contractions and they want to get that baby out. So if they deem that your cervix is ready for this, because the cervix has to make some changes before they can do Pitocin and have it work. If you're deemed a candidate to go right to the Pitocin, they'll start you on Pitocin. The good thing about Pitocin is it's administered through an IV and it's very tightly titrated. So they start it very low and they wait to see if anything happens. They wait to see if you get any contractions and how strong the contractions are. If you're tolerating it and the contractions are mild, they'll turn it up. If they get to a point in turning it up where your body doesn't tolerate it or your baby doesn't tolerate it, they can turn it down quickly. And because it is directly in the vein, it's a pretty quick effect that you'll notice the contractions change. So that's a good thing that it can be so tightly titrated, because other medications used, not just in obstetrics, but in medicine in general, can't be so tightly controlled. So that's the first scenario of using Pitocin. The second is, I actually had a situation where they maybe could have thought about using Pitocin. So if you have a stall like I did for a long, long time in labor, and especially if your bag of water is broken, they may start Pitocin because they're worried about the time factor, that, you've been 7 centimeters for 8 hours and your bag of water's been broken for 20 hours. We really need to get this baby out. They may use Pitocin to do that. So those are the two situations that it's used. Drawbacks. So the huge drawbacks to Pitocin are that the contractions it produces are much stronger and usually closer together than what your body would normally do. So if you are someone who is preparing for a natural birth, part of preparing for a natural birth is learning how to relax and learning how to let go of tension. And your body will produce contractions that seem horrible. But if you've practiced a relaxation, most women can get through that just with their relaxation techniques. Pitocin, on the other hand, produces contractions that are so foreign to your body, it becomes that much harder to relax through them. And that sets up the next intervention. A lot of women that have Pitocin try to relax through those contractions, but they come so frequently and so hard that they get fatigued, and then they can't call on those relaxation techniques anymore because the relaxation techniques take at least mental energy, and they end up with an epidural. So you can see how there's a cascading effect to the very first thing. If you get Pitocin, the chances of an epidural are much higher, simply because the contractions are so much more intense. So is there anything you can do to avoid Pitocin? Well, it depends a lot on your medical provider. Are you with an OB in a hospital? Are you with a midwife in a hospital? Are you with a midwife in a birth center? Are you going to be delivering at home? All of those things will influence the use of Pitocin. Some providers are very stickler about not going very much past your due date. Others will give you 2 weeks, others maybe more. And so that right there will impact your chances of having Pitocin. As far as Pitocin during labor, to get labor going again, that's also very much provider discretion. But the big thing you have in your tool belt to try to avoid that is to move around. So if you've been in bed on your side relaxing and you've been stalling, try getting up and walking. If you've been in the tub, which I did, and I acknowledge now that probably that slowed me down, get up and move around. Try squatting. Try frequent position changes. Try nipple stimulation. A lot of hospitals will let you use their breast pumps for nipple stimulation, which releases oxytocin, which is exactly what Pitocin is. So why not try to get some of that to naturally occur before the medication? So you can certainly try some natural ways to get things going before you try Pitocin if you have a provider that's willing to give you that time. So the next thing, the epidural. So say you're that first situation. You are 42 weeks. Your cervix is perfectly ready to handle dilation. So they decide to start Pitocin. They slowly crank it up, and you're bound to determine you're going to have a natural birth. So you do everything you can. You use the tub. You use walking. You use the therapy ball. You use everything you can to keep yourself comfortable. But these contractions just keep coming one on top of the other, on top of the other, and you're fatigued. You've been at this a really long time, potentially 20, 30 hours. The average first-time mom is in labor somewhere between like 20 and 24 hours. It's not a quick process. So you're tired. I mean, that's a long time to be awake, let alone awake and uncomfortable. So at some point during this, your doctor either says, your baby's not tolerating the contractions. We need to turn the Pitocin down a little bit, and I want you to relax. And the only way they're going to get to you to relax when you have active contractions is to give you an epidural. Or you may decide, this is more than I can handle. I'm not going to be able to push effectively because I am so worn out from trying to get through these contractions that I need some help. And so an epidural is administered. So what an epidural is it's a combination of two medications. Usually it's a local anesthetic and a narcotic combined, and it's put into the epidural space in the spinal column, and it numbs from that spinal level down. So most epidurals now, which is different than a spinal will completely numb you. An epidural just alters your sensation. So most people that have an epidural explain that they still feel pressure, and they still have some sensation, but they can't completely lift their legs. They couldn't necessarily stand up if given the option. They have a blunted sort of sense of what's going on. So it's used simply as a pain management technique. There are certainly benefits to the epidural in the right situation. So there are people that have a baby that it's in a funny position where the doctor just wants the woman's body to try to move the baby down without pushing and without any tensing up. And really the only way to get that effect is with an epidural. So it certainly is a tool that in some cases is an absolute blessing. In a lot of cases, it's completely overused. And the drawbacks of it, so there's a lot of drawbacks. One, as soon as you get the epidural, you can't be out of bed anymore. You can't be ambulatory anymore. You often will get a catheter because you now can't tell when you have to go to the bathroom, or if you can't get to the bathroom. So they put a Foley catheter in, and that increases your chances of urinary tract infections and bladder infections. Another drawback to the epidural is it does get to baby. So we're talking about narcotics and local anesthetics. So something like lidocaine and fentanyl or those are sort of two classes of drugs. And we would never think about ingesting a lot of narcotics during pregnancy. I mean, that's a no-no. But for some reason during birth, it's very accepted, and it's so accepted to the point that it's expected that that's what you're going to do. Because the vast majority of babies in the U.S. are born with an epidural. In fact, 60% of babies born in the U.S. are born with an epidural in place. And that doesn't sound like a lot. I mean, it is a lot, but it seems like it would be more than that. And that's because 33% of babies are born via C-section. And that number, so the 60% is without that 33%. So with epidural babies and with C-section babies, that's 93% of the babies in this country. So it's a huge, overwhelming majority of babies that are born with some sort of drug in the mom's body, because if you have a C-section, you also have to have an anesthetic because you don't want to feel what's going on. So, and the drawback to the fact that the epidural does get to the baby is that we don't really know what the effect is. Our ability to research babies and mothers and different interventions is really limited just because of the ethical problems with studying women and babies, whether babies are born or fetuses before they're born. It's not ethical to give two women two different drugs and say, okay, let's see which baby comes out best. That's just not an acceptable thing for very good reason. But because we can really only retrospectively study what happens, we really don't have a great understanding of the long-term effects of the epidural. There are lots and lots of studies out there that say, oh, babies that are born with epidural have this or have an increased risk of that or whatever. But it's really hard to isolate exactly what was the epidural and what was the home environment and what was the immediate vaccines and what was any medical complications a baby or mom had right after birth. So there's so many things that could be contributing to whatever it is that they think they're studying, that it's very, very hard to pinpoint it. So for a lot of people that choose natural birth, their stance on the epidural is, I don't want it unless it's medically necessary. And as far as what it does to their baby, that just the not knowing what it does is enough to say, I'd really like to try to avoid that. Even though I can't pinpoint that it might do X, Y, Z to my baby, the not knowing is enough for me to say I'd really like to avoid that. So the epidural is, I think I mentioned before, is placed into the epidural space in the spine. It stays in there. So they feed a catheter, they put a needle in your back, they feed a catheter into your back, and then the catheter stays. And you can see on the screen, it looks like an IV. And so that IV bag is dripping the combination of medicines through the catheter and constantly bathing your spinal area with medication. So it's not a one-time injection. It's a constant infusion. So now C-section. So I mentioned before, 33% of babies, it fluctuates year to year, but it's somewhere in the 1/3 of babies in the US are born via C-section. And that rate has climbed in the last 50 years substantially and is a number that is really unacceptable. The World Health Organization recommends a C-section rate around 10%. That's the number that is deemed medically necessary C-section. So C-section is medically necessary for some high-risk moms. Or high-risk babies if the pregnancy has been complicated and there's something wrong with the baby and they know that the baby won't tolerate labor. It is done sometimes for position. If baby is transverse, meaning not feet down or head down, but lying sideways in the belly, there's really no other way to get that baby out. So it'll be done for position. Most areas of the country, if a baby is breech as well, they will not deliver vaginally. It is possible to do it, but most medical providers are not comfortable doing that. So a breech baby, which is about 4% of babies, will be born via C-section. Multiples are usually born via C-section, twins, triplets, quads. Certainly it's possible for them to be born vaginally, just the chances of all babies being healthy and them being in the right position to be born that way just aren't as great as if there's only one baby. So most of those babies are C-sections as well. A C-section is a surgical procedure. A usually transverse incision is made low on the abdomen, and they cut through the skin, the fascia, the muscle, and into the uterus to extract the baby that way. When it's done, so we talked a little bit about that just a minute ago for high-risk babies and babies in bad positions and multiples. But when else is it done? When else can you think of that C-sections are done that don't fit any of those characteristics? I'm almost guessing that all of you can think of a time, or maybe yourself, when you had a C-section and none of those things applied. So why is it that 1/3 of babies are born via C-section? So if we look at the cascade of interventions, we go back to the person who's 42 weeks and has been in labor a long time and gets Pitocin to start her labor going, and she's really gung-ho that she's going to get through this without any help, and gets fatigued and ends up getting an epidural, and the epidural slows labor down. And so they increase the Pitocin. And then the epidural, she has to continue to get the epidural because Pitocin's making things so hard. And they do this dance between the epidural and the Pitocin, epidural, Pitocin. And sooner or later, the baby goes into distress, or mom is so fatigued she can't continue, and they do what they would call an emergent C-section. So that story is, by and large, the most common story for a C-section outside of the sort of more medically indicated C-sections that medical procedures have compiled to take what maybe would have been a normal labor and make it abnormal to the point that one of the participants, either mom or baby, is not tolerating things and they have no other choice but to go in and take it via C-section. So that story, just thinking about all these steps, the Pitocin, the epidural, and the C-section, you can see why trying to avoid the very first step would go a long way to hopefully decreasing your chances of a C-section, because they are very, very tightly related. Drawbacks of a C-section, there's a lot of research out there about the benefits to baby for going through labor and being born vaginally. And you are certainly welcome to do your own research. The big ones that come to mind for me are, as far as the baby goes, there are good bacteria that live in the vagina that the baby is exposed to during birth that is correlated to decreased incidence of allergies and respiratory conditions like asthma and things like that. So that seems like a pretty important thing. I mean, allergies seem like something tame, but if you could avoid your child having allergies just by having them come out the exit hole the right way, that seems like it would be worthwhile. And as far as a drawback for the mom, this is major surgery. This is, now I have an infant to care for who demands all of my attention and more, and I have an incision to manage, and I just had surgery, and I'm uncomfortable, and I'm in pain, and I have a lifting restriction, and I want to be enjoying my newborn, but I'm too focused on trying to get myself so that I can function to actually take care of my baby. So huge drawbacks for the mom. There's increased risk of infection because of the incision. There's increased risk of infection because they would have had to have a Foley catheter during the procedure. There's sometimes bed rest after, depending on bleeding situations. There's scar management and incision management and lifting restrictions. It's when I think about childbirth and think about the discomfort, it's not so much a question of do you want discomfort, it's a question of when. So if you have a completely natural childbirth, your discomfort is during labor. Once the baby's born, it's pretty amazing what those hormones will do. The high that you have after birth, if you've been unmedicated, is second to none. You went from feeling like I can't do this to I'm exhausted and this is never going to end to on top of the world and look at me, I can do anything and I feel amazing and this baby is the best thing that ever happened to me. The bonding hormones and the high that you have after birth is absolutely incredible. So so you've got all these good hormones going around and the pain of the contractions is gone, and the only pain you have with a natural birth would be any tearing that may have happened, which not to be underestimated, that is uncomfortable, but it's still different than having a surgical incision. So the natural childbirth mom has her pain during labor. The C-section mom, especially if it was a scheduled C-section, doesn't feel any pain. Maybe she has a little bit of pain when they do the spinal anesthesia, and then she has her baby and the anesthesia wears off. And that's when she has her pain, when she's responsible for another human being. And to me, it's just my opinion. I would rather have the pain before I'm responsible for another human. I knew when I was pregnant that it was just going to be my husband and I at home for quite a few weeks. Our families are both on the opposite coast of where we live. And the first set of grandparents were only going to come for a couple of days, and my child was going to be a couple weeks old at that time. So I knew that I needed to be able to function, and it would have been astronomically harder had I not been feeling as well as I was. Not to say that I felt like myself the very next day, but I did feel pretty stinking good, and I wasn't in pain. I didn't feel like myself, but I wasn't in pain, and that really went a long way to helping me bond with my child and deal with the issues that he was having, deal with the fact that I was having a hard time breastfeeding and needed some support there. If I had had a C-section and was uncomfortable, I would have been less likely to really stick out the breastfeeding thing and really find answers to my questions, because I just wouldn't have had the energy to do it. So lots of drawbacks to C-section. So I'm going to remind you again about the survey so you can think about your birth and what your desires are and who your provider is going to be. And so you can find that survey at anaturalbirth.org/survey. Now I just want to share with you some birth stories from some of my students. So I am a teacher of a popular natural childbirth method, and I just started teaching about a year ago, and in the last year have happily welcomed 20 babies to mothers and fathers who have taken my class. And it's been an absolutely incredible journey to watch these moms endeavor to fulfill their birth desires. So to date, I've had 22 people take my class, and just this year, and 20 of them have delivered, and we have had no C-sections, which is incredible given what the national rate is. It's also incredible because all of these mothers had their babies in the hospital. So of course the C-section is much less of a risk if you deliver in a birth center or at home, where your provider is going to be less likely to recommend interventions. But all of these babies, all 20 babies, were born in the hospital. So all delivered by midwives or OBs. I believe our count now is that 6 of the 20 have had epidurals. The other 14 have been completely natural. So, and good sized babies too. We're talking babies anywhere from, I think the smallest baby was 6 pounds, 9 ounces, and the biggest baby was 10 pounds. So moms of all shapes and sizes, all ages, all backgrounds, and babies of all sizes can be born naturally when mom and dad are educated and when they're able to have effective communication with their birth team. So these are just a few pictures of some women that have taken my class and their newborns. And I'm going to share a couple birth stories, and the people in these stories are not pictured, and I've changed their names for their privacy. So the first mom was 41 and a half-ish weeks when she went into labor. Her provider was going to allow her to go to 42 weeks, but she didn't need quite that long. She is a petite woman and got to be quite big, although they were never concerned about her baby's size. He ended up being about 8.5 pounds, which was a good sized baby for her frame. So she went into labor and labored at home for a long time. She had the benefit of a family member who works in OB, so she was able to get some checks before she even went to the hospital. So she did not elect to go to the hospital until she knew she was 8 centimeters. And that was somewhere between the 8 and 10 hour mark of labor. And she went into the hospital and they blew up the birth tub because she wanted a water birth. And almost immediately upon getting there, they said, well, you're fully dilated, like go ahead and push whenever you want. And she was thinking, like, this is awesome. I did it. Like, I got through labor. I got to the hospital just for the birth, which is what I wanted because I don't want any interventions. And she pushed in the tub, and she pushed standing up, and she pushed squatting and in sidelining. And she pushed for 3 hours with really not a lot of progress. And her providers were really baffled by it. She really had them, they weren't really concerned as much as they were wondering, like, well, why is this baby not coming? We know baby's engaged in the pelvis, and we know that she's fully dilated, and we can tell by what her perineum is doing when she's pushing that she's being effective. Why is this baby not coming? So they suggested to her, because of her fatigue level, that she get an epidural. And she obviously didn't want to do that, but also was not seeing any other alternatives, considering she was pushing in every position she knew how to push in, and was being told she was effective as far as the muscles she was engaging, but that baby wasn't moving. She really felt trapped. Like, what do I do to get this baby to come out if all this pushing isn't working? So she did take the epidural, which allowed her to rest. And she rested for a couple of hours and labored down. And so when a doctor says labor down, basically what they mean is, we're going to give you the epidural in hopes that your contractions continue, and that the contractions hopefully will help the baby move further down the birth canal without you having to do anything. It's a very common term used in conjunction with an epidural. So she rested for a couple of hours, and when they came back, she was +2 or +3 station, which means like basically almost out. The baby was like almost out, and had done that just because she was able to relax, and her contractions had helped push the baby down. When they examined her at that point, they realized why it was that her pushing wasn't effective. And the reason was a couple of things. One, baby was big. Two, baby was sunny side up. So instead of baby facing mom's spine, baby's face was up. And that position is a not preferred position for birth, only because the head and the pelvis are not as congruent in that position. So it's not as easy for baby to fit down. And certainly with a smaller mom and a bigger baby, it was that much more difficult. Baby was also what they call asynclitic. So his head was tilted towards his shoulder, which meant that, again, the symmetry of moving through the pelvis was very challenging. And so because he was asynclitic, they put the vacuum on the baby's head at that time, not to pull the baby out, but just to straighten the head of the baby. And with the next contraction she pushed in, he came out. So clearly for her, the epidural was probably necessary. And without it, she maybe would have ended up with a C-section, because baby's position and her anatomy were not working very well together. She didn't have an epidural in place very long, and she did all of labor without the epidural. It wasn't until the pushing phase that she got the epidural, which I will warn you is not common practice. Most providers, if you get to the pushing phase, will not offer an epidural, because it does make pushing less effective. And it's sort of like, well, you've done most of the work. Why do you need it now, kind of thing? This is sort of the home stretch. And the reason for her that it was offered was probably to give her rest and to see if this baby really could be born vaginally, or if they were going to have to do a C-section. So that baby is now, actually, he is 3 months old today, and he is doing great. He's growing fast. Mom is doing well. She had a very easy recovery and is doing wonderfully. So obviously it wasn't her dream birth, and it wasn't what she had hoped for, but in the end, it was what was best for her baby and for her. So that's an example of using one of the cascade of interventions, but in isolation. So she didn't have Pitocin, and she didn't have a C-section. She got an epidural when it was not so much because she wanted it, but more because it was medically indicated. And because of that, it stayed isolated as just the epidural and not anything else. The other birth story that I wanted to share is unique because I had a mom who was way past her due date, like 42 weeks in a couple days. And she had begged and begged and begged her provider to let her go a couple more days. And finally, at 42 weeks and a couple of days, they said, we can't compromise anymore. We're worried about fluid levels, and we're worried that your placenta is starting to not work anymore. We need to induce you. So they wanted to induce her starting with Cytotec or Cervidil, I'm not sure which is a topical cervical agent that is supposed to soften the cervix. And her provider felt like even though she was starting to dilate already, she was a couple centimeters dilated when they started the induction, that would be a one-time thing and hopefully get contractions going, and that would be all she needed, because her provider knew she wanted a natural birth. She wanted to try something less than Pitocin first. So they did the Cytotec or Cervidil, I'm not sure which, and contractions started, and they were really strong and really intense, and they didn't help her progress. Her dilation didn't change at all. They stayed exactly the same. So then her contractions started to peter out, and they said, well, you haven't progressed, and that didn't work, so let's try Pitocin. And they did Pitocin, and she felt like, compared to the contractions with the Cytotec or Cervidil, that the contractions were actually a lot more manageable. And so she labored on Pitocin without an epidural, and was able to deliver without an epidural. So she was able to stop the cascade of interventions just at Pitocin. And honestly, I can say I don't know anybody else who's ever been able to do that. I've had a couple of women, in fact, of the 6 women in my classes that have had epidurals, 3 of them had Pitocin, and all of them tried at least 5 or 6 hours on Pitocin before they got the epidural. So it was a valiant effort on their parts, but they weren't able to do it. So how she could do it, I'm not really sure. She thinks that because the contractions initially with the Cytotec or Cervidil, whichever one they used, were so intense that compared to those, the Pitocin contractions weren't as bad. And perhaps also because she knew she was making progress, she was able to mentally stay in it. I know she practiced relaxation intensely. She took my class. She changed providers during her pregnancy because she wanted a different experience. So she was a very proactive mom, and she had a very supportive coach, and she was able to do it without the epidural. And when I heard her story, I was partially in shock and partially elated and partially wanted to cry. I was so excited for her and so impressed by it, and just wanted to know every little step of her story, because it's so rare that we have people that are induced with Pitocin and don't end up with an epidural. So I wanted to give you 2 examples of people that didn't have the kind of birth that I had, where it just was a natural birth and nothing happened, because those stories, although they're all different, they're similar in the sense that there was never medical intervention. But for these 2 moms, they both had the goal of natural birth, and one of them ended up with an epidural and one of them ended up in Pitocin. Neither of them ended up with a C-section, and neither of them ended up with the birth that they wanted, but they both were so educated and able to be active participants in their care that they were still able to have a birth similar to what it was that they wanted. And they both feel relief over having that power over what happened, because it's very empowering to have choice, and it's very disempowering to have things done to you when you maybe are not educated about what's going on or just don't understand what's going on. So what's the key to a natural birth? And in my opinion, the key is education, which will lead to advocacy and teamwork. So if you are able to get yourself educated via classes or lots of reading or mentoring or coaching, or however you get the education, that will turn you and your partner into a better advocate for yourselves and your baby, which will in turn increase your teamwork with each other and with your medical providers. If you're able to speak the same language that your medical provider speaks, there's a much greater sense of teamwork, that everyone's on the same page. And certainly getting a natural birth in a hospital setting, there's a lot of advocacy involved. You have to let your provider know, this is what I want. This is really what I'm going for. Can you help me achieve this? As long as it's medically necessary, can you help encourage me to have this outcome? You have to be good communicators to get the birth you want. If you're in a setting that is sort of atypical, and in a hospital, it's not that common to have a natural birth. At home, obviously, that's the only thing that happens. So taking into account where you're going to be is certainly important as well. So I wanted to thank you for joining me today. I hope that this has been informative for you. And I just want to leave you with a few questions that I got during this talk. So Mary wrote in and said, is it possible to be induced and not end up with an epidural? So we talked about that with the woman that I just discussed who had a birth with Pitocin and didn't have an epidural. So yes, it's possible, but is it common? No. The exact statistics, I don't know, but I would guess it's a very, very low number. Kate wrote to me and said, what can I do to reduce my chances of C-section? So I would go back to this slide and say education. Education is probably the best thing you can do, because if you're educated, you're going to understand how to keep yourself low risk. If you're low risk, you have more options at the time of birth. And if you have more options, the chances of a C-section happening are far decreased. On the contrary, if you're not educated and don't keep yourself low risk, C-section may be the only option on the table for you. So getting the information and actually acting on the information. So getting the information about how to stay low risk isn't enough. You actually have to put that into practice. You can't just know I need to exercise and I need to eat a well-balanced meals to be low risk. You actually have to do that too. So just getting educated isn't enough. You actually have to practice what it is that you're learning. And Susan wrote in and said, how can I avoid medical induction of labor? So really good question. I'm assuming Susan is talking about induction of labor in terms of I'm past whatever date my doctor wants me to be. So I would highly recommend before you get to that point that you find out when that date is for your doctor. Is your doctor somebody who wants to deliver people no later than 41 weeks? Is your doctor somebody who will let you go to 42 weeks? In some parts of the country, it's rare for them to let you go past your due date. But understanding when that is certainly helpful psychologically for you to know sort of when your expiration date is, if you will. So as far as what you can do, staying active, walking for sure helps. Any upright activity helps. Limiting your sitting helps. And then there's a whole slew of natural induction techniques that you can try that if your body has started to make the changes necessary for birth, meaning you're starting to dilate, you're starting to be effaced, babies may be dropping a little bit, that some natural induction techniques may be what your body needs to send you into labor. If you're not ready for labor, a natural induction technique is not going to make any difference. But if your body is starting to make changes, it may be the difference. And we can talk about what natural induction techniques exist in another webinar. If you're interested, please let me know what topics you want to learn more about, what's interesting to you, what you really don't want to hear about again. I'm hoping to do webinars on a regular basis as well as have a podcast. So hopefully a lot of these topics will come up and you'll be able to get the information that you're desiring. So those are the questions that I got. I wanted to thank you again for being here. I greatly appreciate your time. I encourage you to fill out that survey at anaturalbirth.org/survey and contact me at rebecca@anaturalbirth.org with any questions. I, in addition to doing webinars and podcasts and in-person classes here in my local area, do some online coaching. I'd be interested if you would like some mentoring along your pregnancy to help you achieve your goals, or if there's a group of you that are in some remote area that would like some group coaching, please let me know. I'd love to help you. I'm really passionate about bringing babies into this world in a more natural way. And that doesn't necessarily mean at home. I'm talking about people who want information to be educated to make better choices regardless of where they choose to give birth. So thanks again for your time, and I will talk to you again soon.